Well, welcome, Representative Krasnick.
Thank you. It's good to be back with some familiar faces and some new faces.
You know everyone in the committee? Have you met?
I haven't. I would love
We'll
to.
do a quick
Yeah,
introduction.
that'd be great.
Go ahead, Representative Morgan.
I'm Leland Morgan. I represent Grand Isle County and West Milton.
Welcome back.
Ken Lipsky, mile one south.
And as we're talking, Richard Nelson, Orleans one, Derby.
Michelle Bosling, Wyndham 3.
Greg Burt, Danville Kitchen.
John O'Brien, Royalton and Tunbridge.
Heather Supernut, Barnard, Falmouth, Bridgewater.
David Durfee, Shaftesbury, Sunderland, and Glastonbury. And Sedonia.
Of course, old friends.
We'll turn it over to you.
All right. Well, thanks for having me. Good afternoon. For the record, Representative Emily Krasnow, Chittenden 9, South Burlington. And I am here to talk about H14. So for decades, animals have been subjected to cruel and painful experiments for the creation of cosmetic products. However, modern research methods such as human cell-based tests and computer modeling have rendered animal testing unnecessary. With the increasing availability of non-animal alternatives and thousands of existing ingredients, there is simply no excuse to continue to subjecting animals to suffering for products like shampoo, mascara, and aftershave. H14 requires companies that test products, including cosmetics, household products, pesticides, drugs, vaccines, or industrial chemicals to prioritize non-animal test methods when they are developed and available, they provide equivalent or better scientific quality, they are approved by federal agencies as acceptable alternatives to traditional animal tests. When non-animal methods are not yet accepted, companies must use testing methods that reduce the number of animals involved to minimize suffering when available. The bill is forward-thinking and does not ban testing for which no alternatives currently exist. H14 also mandates basic reporting from testing facilities on the number of animals used and the alternative methods employed. What are some of the limitations of animal testing? Many traditional animal test methods still in use today were developed decades ago and no longer reflect the best science has to offer. Animal models carry significant scientific limitations and are no longer considered the gold standard of testing. Different species may respond differently to the same chemicals, meaning animal test results may not accurately predict human responses, leading to under or overestimated health risks. What alternative test methods are currently available? The National Toxicology Program's Interagency Center for the Evaluation of Alternative Toxicology Methods provides a list of more than 100 accepted methods that reduce or replace animal use. Companies can utilize models based on reconstruction of human skin or cornea to replace traditional eye and irritation tests. For skin allergy tests, scientists have identified biological events in human skin that can predict allergic reactions to chemicals, eliminating the need for living animals. Why should Vermont pass this law? 21st century science is moving away from outdated animal tests in favor of faster, less expensive, and more human relevant methods. H14 is a reasonable step towards accelerating this transition. As new alternatives emerge, this law will help incentivize their use. Companies that use animals for testing have an ethical obligation to minimize animal use whenever possible. This law aligns with ethical responsibilities. 4 states, Virginia, New Jersey, New York, and California, have already passed similar laws, and a similar bill to this is being considered right now in Massachusetts. H14 ensures that Vermont companies adopt the latest, most humane testing strategies as soon as they are approved for use. And now I am happy to answer any questions.
Start with Representative Nelson then.
Thank you, Chair. Would this have impact on, and I'm a sponge, I wanna learn. Will this have impact on like if UVM does cancer research. Will it have impact on other types of things like that?
Sure. So, we can, I have, so one thing that the bill does is directs to also understand what tests are being done. We currently don't know the amount of animals. That's a question that I've been asked quite a bit, is how many facilities or research centers in Vermont are doing these tests right now. And unfortunately, we don't have that data because no one's required to talk about it. So, but I can tell you that, you know, this is based on statistics that we have, from national numbers that this is happening. But, as far as cancer research specifically, again, this doesn't force anyone to change their practices, right? Oh, I'd like some assistance from it's my understanding that it is directing them if it's available.
Katie McMahon, Office of Legislative Counsel. Hello, everyone. It's my first time in the committee. It's nice to see you all.
You're welcome.
There is a carve out for biomedical research,
Okay.
and that's defined as, it means the investigation of the biological processes that cause, the causes of disease or research conducted to increase fundamental scientific knowledge or to expand the understanding of how processes in living organisms develop and function.
And then just a real quick follow-up. So like at UVM, at the UVM farm, the fistulated cow. Yes. They put samples in, stuff to see what the rate of digestion, absorption is and whatnot. That would still be allowed.
I would have to understand more.
They,
about the
they
test.
put a, they put a window into a cow so they can insert stuff directly into the rumen and then pull it back out. It's been done for years. It's installed under,
I've seen the cow.
yeah, they're fine with it as far as myself as a farmer would say they're fine with it. I just want to make sure that I'm asking, does that affect that? But by the definition you just read, it shouldn't, because it's done for biological data.
This bill is focused on the testing of animals or testing on animals with regard to products that are used by humans. So looking at the safety and efficacy of like chemicals that humans might put on their body, first testing them in animals before testing on humans. So that is sort of the main focus, different from research on livestock.
Yep, thank you.
Representative Boslin.
Yeah, so I just wanted to ask a sort of a clarifying question, I guess. You said that right now there's sort of no record of who's doing testing. And so like, it actually just made me remember, and I just looked it up. It was 5 days ago, it was in the news that apparently there was this botched medical research, or no, not medical, botched animal research that was happening at Middlebury.
Yep.
And like, they were supposed to be anesthetizing animals and they were cutting them up without using proper anesthetic. And just like, it sounds really quite horrible.
It is.
And we don't, I mean, the idea that we don't have a record of what is happening with animals that are being used for scientific or other kinds of situations really seems untenable. So I think you're really doing an important service in bringing forward this bill, and I hope we're able to look at it.
Thank you. And yes, I think that's an important piece of this bill, that we would like to know that data, and it would, that was a timely, if you will, article to this. And I didn't know that obviously was happening, and quite concerning. And I think that we do need to have that kind of data to know, and it would also help on a, you know, a level of all across the country to really know what we're doing.
Senator O'Brien.
What's the jurisdiction of a bill like this? Like, would it only cover this animal testing in Vermont, or if we use, say, products that
It's a great question.
have been tested in California but were sold here ultimately, could it work its way back up?
You can go ahead. I think I know, but we'll let
Yes.
Katie handle
The
it.
way this is drafted, it's focused on facilities in state that are producing these type of products that are tested on animals. So it's not regulating Commerce, what's coming into the state, it's regulating the facilities that are doing the testing.
And the other 4 states similar.
I haven't taken a deep dive into the other 4 states, but if you're interested, I can.
Yeah, no, that was a question that I actually 2 years ago had a similar bill, and that was a question that I was curious about as well, because that is hard to, with commerce, to keep track of where things travel or start here and then they go somewhere else, for sure.
Representative Lipsky.
Yeah, thank you. Thank you, Emily. Just for context. Are you talking about agricultural animals or what are the range? Are there several hundred different animals?
Yeah.
Just farm animals?
No, actually, yeah, I have a list here of, again, we don't know. That's the one of the problems is we don't know what specific animals, but as far as some of the USDA, they do compile some annual statistics, and some of the animals that they're saying are used are cats, dogs, guinea pigs, hamsters, pigs, primates, rabbits, and sheep. And of course, as we read, for folks who recently read about the article about the college, mice and rats are very commonly used. But again, we don't have that information, and that is part of the bill that I would really like. I think many people would like to know what is going on in those facilities. But those are some of the animals that the USDA provides that are in those categories for animal testing. And the word, I mean, I know we're many animal lovers in here, but the beagles that are sometimes used, that I'm sure that's been, people have seen those articles about the beagles.
Well, let's have Representative Morgan, and then maybe we can bring Katie up to.
Okay.
Do we have companies or businesses in the state of Vermont that are using these animals for studies in cosmetics or shampoos or whatever? Are there actually companies here in Vermont that are doing that? Or is this this bill hoping to prevent that from happening?
So I don't know if you have an answer. I have
I know you had.
yeah, that's something I really looked into. So, it's hard to know because there's no data. So we don't have a directive to know that, but it's my understanding from my research over the past few years that it's more of a prevention, but also a directive. So it's not, again, this is finding alternatives when possible, which we'll during the walkthrough can talk about, but I can't say for sure that there aren't, I don't think there are like companies here in each of our towns that might be having, we don't have the scale to be able to do that, but they are happening in research facilities, which I don't have to, that there's a recent article that can point to that. But yeah, so yeah, but it's not like a big manufacturer or something like that has, I don't think, I hope not, a room full of mice that are testing mascara. But this is part of being forward thinking and a part of an animal welfare, of other states are doing this and looking at this so that we can continue to build that momentum. And I mean, I personally believe that this should be a national standard, that we should not in 2025, because we don't need to. There is better science that can support the things that go in our body than using cruel animal testing. But no, I don't think that we have those facilities in our backyard, like stores and places like that. But I'm sure we'll find out if they oppose it.
Before we have Katie come up, did anybody else have a question for Representative Krasno? Great, thank you.
Yeah, I really appreciate your time, and it's great to meet all the new folks and see some old friendly faces, and thanks again for giving me this time.
See you.
Of course, and I'm always available. I'm in the building downstairs if anyone ever wants to chat.
So now we're gonna have ledge counsel come up and Katie will put the bill up as introduced. It's 4 pages, I think. Walk us through. If we have questions about the language or the implications or definitions, those are good questions to direct at Katie. She may not have the answers to the broader policy questions, but since we still have Emily in the room, maybe we'll have her tag team if we need to. Do you have the screen sharing ability that you need here?
Yes, looks good. Pull it up. All right. So again, Katie McLeod, Office of Legislative Counsel. I don't spend much time in this committee, as I said. I typically spend time with your neighbors across the hall, Human Services and Healthcare. I have worked on pieces of legislation that deal with products that humans put on their body and contaminants that might be in those products. So today we have a bill in front of us that prohibits traditional testing on animals if the state of Vermont or federal agency, whoever's responsible for regulating that product, has said that there's an alternative non-animal test available, or that the state or federal agency responsible for regulating a product has waived the need for a traditional animal test. So that's sort of the broad brush of what we're going to be looking at. So we're creating a new subchapter, use of animals in product testing. We have a definition section. The definitions are pretty important in this section, so I'm going to spend a little bit of time here. So first, I use the phrase alternative test method or strategy. So this is meaning alternative to animal testing. So it means a test method including a new or revised method that does not use animals, provides information of equivalent or better scientific quality and relevance compared to traditional animal test methods, and includes computational toxicology and bioinformatics, high throughput screening methods, testing categories of chemical substances, tiered testing methods, in vitro studies, and microphysiological systems. There is a question about what animals do we mean. In the bill, it's defined as a non-human vertebrate. And then here's the language about biomedical research, which becomes important because later we sort of have a carve out that says biomedical research is not affected by this prohibition. So this first sentence that I've already read outlines what biomedical research is. It means the investigation of the biological processes and causes of disease or research conducted to increase fundamental scientific knowledge or to expand the understanding about how processes and living organisms develop and function. What is not biomedical research? It doesn't include testing done to assess the safety or efficacy of chemicals, ingredients, drugs, vaccines, product formulations, or products. So those are the types of tests that are sort of being targeted here with regard to saying animals cannot be used for these types of tests. As I said earlier, we're regulating product testing facilities. That means an entity, institution, business partnership, corporation, association, or other legal relationship that tests chemicals, ingredients, drugs, vaccines, product formulations, or products. And then, as opposed to the definition we looked at around alternative testing, we have a definition of what is a traditional animal test method. It means a process or procedure or experiment using animals to obtain information on the characteristics of a chemical, ingredient, drug, vaccine, product formulation, or product, and that generates information regarding the ability of the chemical, ingredient, drug, vaccine, product formulation, or product to produce a specific biological effect under specified conditions. So that is our subsection A is our definition section, and then we start to move into what the prohibition is exactly. So in subsection A, subdivision 1, a product testing facility that's operating in this state shall not use a traditional animal test method if a state or federal agency that's responsible for regulating that specific product or activity for which the test method is being used has either approved an alternative test, and that, going back to our definition, the alternative non-animal test or strategy, or has granted a waiver exempting a product or activity from the required traditional animal test method. In subdivision 2, when there is not an alternative test method or strategy or waiver available, a product testing facility shall use a traditional animal test method using the fewest animals possible and taking precautions to reduce animal pain and stress. So in the instances that there isn't the waiver that we've discussed, there is an alternative test. This authorizes the use of a traditional animal test, but is looking to mitigate the impacts on animals. And then we have some carve outs. So in subdivision 3, nothing in this section shall apply to any animal testing conducted for the purpose of biomedical research. So that was the question that you had. There's the carve out. Nothing in this section shall prohibit the use of any non-animal test method or strategy for the testing of any chemical, ingredient, drug, vaccine, product formulation, or product, even if there is not an alternative test method or strategy. In subdivision C, nothing in this section shall prohibit the use of a traditional animal test method as required by state or federal law. So if it's a requirement that a traditional animal test has to be used, this act doesn't change that. Or I shouldn't call it an act, this bill doesn't change that. And then nothing in this section would prohibit the use of a traditional animal test method that complies with a written request from a state or federal agency when the agency has approved an alternative test or strategy, but has also expressly concluded that a traditional test method is needed to fully assess the impacts of the product or activity on the health and safety of consumers. So even if the regulating agency has approved an alternative test, but there is a written request from that agency, in this instance, we need to do a traditional animal test to assess if this product is safe on humans, then nothing in this bill would change what the agency is asking the facility to do. And then we have some data collection. So on or before February 1st of each year, all product testing facilities that are operating in the state are to submit a report to the Office of the Attorney General regarding any animal testing conducted under this section during the previous calendar year. Each report shall include the number and species of animal used for traditional animal test methods, the type and number of animals, the type and number of alternative test methods used, the number of waivers used, and the purpose of any traditional animal test methods, alternative test methods, and waivers. The Office of the Attorney General is to publish on its website the results of this data that's collected within 90 days of receiving the report. And then we have some violation language. A violation of this section that we've just been through is deemed a violation of the Consumer Protection Act. The Attorney General has the same authority to make rules, conduct civil investigations, and enter into assurances of discontinuance and bring civil actions, and private parties have the same rights and remedies as provided under the Consumer Protection Act. So this language in D ties a violation of the section to the Consumer Protection Act that calls in the AG's enforcement authority. It also creates a private right of action with treble damages under the Consumer Protection Act. And then we have our effective date. So this act shall take effect on July 1, 2026. So we have almost a year and a half of lead time before this would take effect. And that is it.
Okay, thank you for walking through that.
Sure.
Let's leave it up on the screen for a minute and see if anybody wants to go back and look at any particular section. And again, Representative O'Brien.
do you define product at any point? I mean, earlier you mentioned that
Mm.
products meant for humans, but I was thinking like dog or cat shampoos, or say there's a byproduct like, the byproduct from breweries, for example, are being fed to animals here, but something like that, that was being tested to see if it could be used as a forage for animals, something like that. Would that be considered a product?
I think that's a good question. It's an open question because the draft doesn't define product. I was looking back to where we have the biomedical research definition, and even that doesn't specify who a chemical ingredient or vaccine is for. So I think it's an open question the way this is drafted. Yeah.
Representative Nelson.
Thank you. A lot of vaccines. Maybe not, maybe because they kind of formulate them the same. I just wonder if a lot of vaccines are tried on animals first. Of course, the most recent one we all think of, they should have tried it on themselves first, but they might have done that. We did a product development, so I got an actual case in point. You tell me if it would work. We started with 100 heifers drawn blood to get a baseline on throughout their menstrual cycle of where hormones ran.
Mhm.
And then we bred the heifers. And then we drew blood throughout. And then throughout pregnancy, and then 30 days postpartum. And it was used to develop a pregnancy test by IDEX Labs.
Mhm.
So we weren't injecting or treating them any different than we would, except we were drawing blood.
Mhm.
Would that trigger this or not?
The focus of this is testing ingredients,
So
products on animal. A blood draw
Yeah.
seems separate and apart from
Yeah.
the testing of a product.
Okay, thank you.
Mhm.
That clears up a lot.
And if I may, and if you do decide to work on this bill at all, your question or other things like through the committee process, you can add or change anything you like.
Katie, could you scroll down to the bottom of this page, I think, product testing, yeah. So a facility shall not use a method if a state or federal agency responsible for it, and then it goes on. I'm wondering in our state, if you can tell us, if you happen to be able to tell us what agencies would apply here, which agencies that would be referring to?
I'm trying to think off the top of my head.
The new animal welfare person.
Well, it would be a product that's regulated by an agency, so it probably wouldn't be an advocate. It would be, I don't know if there are any products that the health department is regulating. PFAS is coming to mind because there's a big discussion on who regulates, what entity of government regulates products containing PFAS.
Yeah,
So in the end, I'm not very helpful on this question.
okay, yeah, it goes on. I mean, I probably should have had you read a little farther just for finishing the sentence, but it goes on to say, if the agency has essentially authorized or approved in one of these alternative methods, and wondering whether that's happened in Vermont, whether we have any state agency that has said, here's an alternative method that would work. So we can look into that if we pursue this, yeah.
Have to dig in with some testimony from others, yeah.
Representative Nelson.
What I like about this bill is they have 4 or 5 things in this bill shall not pertain to if.
Right.
If there's no alternative, if it's deemed that it's necessary, if. And so I think they covered a lot of it really well.
They meaning Representative Kraus.
Yes, exactly.
No, that's a really important piece, exactly, like, you know, that's a huge piece of it as well, and what other states are doing too, that it's like, thank you.
Okay, well, anything else you wanted to close with?
No, nothing from me.
Thank you for coming in.
Thank you.
Thank you.
Yeah, you all know where to find me. Downstairs.
I've been mixed by my personal expert,
Oh, you did?
my wife.